You know the feeling, right? You're trying to enjoy a meal, and then bam! That sharp, stinging pain from a tiny little spot in your mouth just ruins the whole thing. It's a canker sore. So annoying. But what if those painful little ulcers are more than just a random nuisance? What if they're actually a message from your body? Well, let's find out.
So, here's what we're going to cover. We'll start with that familiar pain and figure out what a canker sore actually is. Then, we'll get into some tips for healing them faster. And then, we'll get to the big question. What does it mean when they just keep coming back? And, most importantly, when is it time to talk to a doctor?
All right, first things first. Let's make sure we're all on the same page. What exactly is that painful little spot in your mouth?
So, a canker sore, or what doctors call an aphthous ulcer, is basically a shallow wound. It has a really distinct look, a whitish-yellow center with this angry red ring around it. And you'll almost always find them on the soft parts of your mouth. Think inside your cheeks, on your tongue, or the inside of your lips.
Now, let's clear up one of the biggest points of confusion out there. Are canker sores the same as cold sores? The answer is a big, fat no. The key difference is all about location. Canker sores are inside your mouth, and they look like little craters. Cold sores, on the other hand, are usually outside on your lips and look like a cluster of fluid-filled blisters. But the biggest difference of all is canker sores are not contagious at all. You can't give them to someone by kissing them, sharing a drink, nothing. That's because they aren't caused by the herpes virus like cold sores are. So that's definitely one less thing you need to worry about. So if you don't catch them from a virus, where in the world do they come from? Well, the truth is, it's usually not just one thing, but a mix of different factors.
Here's a list of some of the usual suspects. It could be something super simple, like accidentally biting your cheek, or just brushing your teeth a little too hard. Stress and not getting enough sleep? Oh yeah, those are huge triggers. For some people, certain foods can set them off. Hormonal changes can also play a role. And hey, if your parents got them a lot, you might be more likely to as well. And finally, a really important one we're going to come back to, not having enough of certain vitamins and minerals.
Okay, knowing the cause is one thing, but let's be real. What you really want to know is how to make the pain go away faster, right? So let's get into some practical tips.
Here are 4 simple things you can do right now to get some relief. Number 1, just avoid things that will irritate it more. So, lay off the super hot, acidic, or spicy foods for a bit. 2, rinse your mouth out. A simple salt water or baking soda rinse works wonders to soothe the area. 3, protect it. You can find gels at the pharmacy that create a little shield over the sore, which is an absolute lifesaver before you eat. And finally, keep brushing your teeth, just be extra gentle around that area.
Okay, so now we're getting to the real heart of the matter. Getting a canker sore every now and then is pretty normal. But what if they're a constant, unwelcome guest in your mouth? This is where that simple annoyance could be a much more important signal.
So, what's it mean if you feel like you're just in a constant cycle? You know, one sore finally heals, and then boom, another one pops up. This pattern, the one where they keep coming back, is what we really need to pay attention to.
Recurrent canker sores can actually be a sign of something else happening in your body. Let's break it down. It might be a nutritional deficiency. Your body could be low on key players like vitamin B12, iron, or folic acid. Or it could be a clue to a systemic disease like Behçet's, Crohn's, or Celiac Disease. And finally, it can be linked to issues with your immune system. It really is true, your mouth can be a window to your overall health.
So with all that in mind, how do you know when it's time to stop trying home remedies and actually make an appointment to see a doctor?
Here are the red flags you shouldn't ignore. If a sore just won't heal after 2 or 3 weeks, that's a sign. If the pain is so bad it's making it hard to eat or drink, or if you're getting them really frequently, it's time to get it checked out. And pay close attention if you have other symptoms along with them, like a fever or just feeling wiped out. And a really big one, if you're also getting sores on other parts of your body, that's a definite signal to see a professional.
When you do go see a doctor, one of the first things they'll probably want to look into is a nutritional deficiency. It's pretty straightforward. A simple blood test can check your levels of B12, iron, and folic acid to see if that might be the root cause of the problem.
And this isn't just a hunch. This is backed by solid science. As this research finding shows, a lack of vitamin B12 can play a direct role in what causes these sores to form. For a lot of people who get them over and over, finding and fixing a deficiency like this can finally be the thing that breaks the cycle for good.
So the next time a canker sore pops up, instead of just thinking of it as a pain in the mouth, maybe ask yourself a different question. Is this just a sore, or is it a signal? Paying attention to these small clues is such a powerful way to stay tuned in to your overall health. So, are you listening to what your body might be trying to tell you?